Unit 7 Test Question 1. A clinic nurse notes that the physician has documented a diagnosis of herpes zoster in a client's chart. On the basis of an understanding of the cause of this disorder, the nurse would determine that this definitive diagnosis was made following which diagnostic test? 1. Skin biopsy. 2. Wood light examination. 3. Culture of the lesion. Answer 3. Culture of the lesion. 2. A community health nurse is visiting a homeless shelter and assessing the client in the shelter for the presence of scabies. Which assessment find would the nurse expect to note if scabies is present? 1. Multiple straight or wavy thread-like lines under the skin. 2. White patch on the elbows and knees. 3. Pustules on the trunk of the body. 4. Brown red macule with scales. Answer 1. Multiple straight or navy thread-like lines under the skin. 3. A client is being admitted to the hospital for a treatment of acute cellulitis of the lower left leg. A nursing student is assigned to care for the client. The nursing instructor asks the student to describe this diagnosis and determine that the student understands the diagnosis if the student states that this is which of the following. 1. It is a skin infection into the deep dermis and subcutaneous fat. 2. It is an acute superficial infection. 3. It is an inflammation of the epidermis. 4. It is an epidermal infection caused by the staphylococcus. Answer 1. It is a skin infection into the deep dermis and subcutaneous fat. 4. A nurse is assigned to care for a client with herpes zoster. Which of the following characteristic would the nurse expect to note when assessing the client lesion of this infection? 1. A generalized body rash. 2. Small blue white spot with a red base. 3. A fiery red edematous rash on the cheeks. 4. Cluster skin vesicle. Answer 4. Cluster skin vesicle. 5. A nurse manager is planning for the clinical assignment of the day. The nurse manager avoid assessing which of the following staff members to a client with herpes zoster? 1. A nurse who never had mumps. 2. An experienced registered nurse who never had chickenpox. 3. A nurse who had never rosella. 4. A nurse who never had a German measles. Answer 2. An experienced registered nurse who never had chickenpox. 6. A nursing student prepare a plan of care for a client with diagnosis of acute cellulitis of the lower leg. The nursing instructor reviews the plan of care which a student determines that the student understands the treatment measures if which of the following is included in the plan of care. 1. Applying warm compress to the affected area. 2. Applying cold compress to the affected area. 3. Applying heat lamp treatment 4 times daily. 4. Alternating hot and cold compress every 2 hours. Answer 1. Applying warm compress to the affected area. 7. A nurse is preparing to perform an assessment on a client being seen in the clinic. On reviews of the client's record, the nurse notes that the client has psoriasis. The nurse would expect to note which of the following characteristic assessment of the client's psoriatic lesions. 1. Large plaques covered by silver scale. 2. Tiny red vessels that weave serous material. 3. Pink and dark patchy eruption on the skin. 4. Erythema noted mostly under the breast area. Answer 1. Large plaque covered by silver scale.